guys, Keisha Nicole here. Keisha Nicole here. Welcome. I am with the Gulf Coast Community Service Association, Incorporated, better known as GCCSA, which provides Head Start and Early Head Start program. And, I have two phenomenal women here with me today. First, we have Dr. Janita Reynolds, the Chief Executive Officer.
Hi.
Hi. And then we also have Tia Moya Lee, who is the Director of Head Start, Early Head Start.
Good afternoon. How are you?
I am doing wonderful, ladies. How you guys doing today?
We're good. You're good.
Excited to be here.
Yes, I look good.
Thank you.
Can you guys just tell me a little bit about yourselves before we jump right in?
Sure. Keisha, I'm Janita Wallace Reynolds, and I'm the Chief Executive Officer, as you mentioned. I've had the pleasure of serving as CEO of Gulf Coast Community Services Association for over 17 years. I love what I do. It's my passion, my purpose, and it allows us to make a meaningful impact on those who are unserved and underserved in Harris County. I was born for this. I have it running through my veins. I have my doctorate in educational leadership and cultural studies and have done quite a few things, but I'm so glad I landed here at Gulf Coast. I wouldn't change my course for anything in the world.
I love it. I love it. Thank you. What about you, Ms. Lee?
Keisha, thank you. I've been here for about 13 years with Gulf Coast. I previously worked here with local school district as a pre-K and kindergarten teacher and found the opportunity in Head Start several years ago and have loved it ever since. Love working directly with the children, our families, and our amazing staff and colleagues that I have here who really work to make sure that our families are getting everything that they need to help their children be ready for the next step. So always work with children, always work with families, and I love what I'm doing.
I love it. Now I want to start with you, Ms. Lee, but Dr. Reynolds, feel free to jump on in when you want to. What are the benefits of Head Start, Early Head Start programs?
So the benefit of Head Start and Early Head Start program is not just for the child, but we start with the child. Parents have the opportunity to enroll their children in a child care educational setting. And we have Early Head Start, which is babies 0 to 3. And then we also have Head Start, which are children who are 3 to 5. And we have the opportunity to put them in this educational setting to help them progress and get ready for school. So when they get ready to go into the public school or the next educational setting, they're really ready. So we teach them a myriad of skills to make sure that they are going to be ready and successful throughout their educational career. They're just starting, and we're trying to make sure we give them the head start.
Now, what have you seen in the past, the benefits of this Head Start?
So definitely some of the things that we have seen and we measure as a program is our children's outcomes. How are they progressing? Children that come to us as infants and toddlers, they are working on their learning how to walk, their sounds, their recognition of not only their families, but their teachers and their surroundings. And you would be surprised, but babies and toddlers actually need that schedule. And they learn it in the system working with us on a daily basis. Also, in our Head Start program, really see a lot of outcomes with children with their cognitive learning. So getting them ready to read, learning their letters, their numbers, and just really building their social skills, being a part of that classroom and becoming a real integral part of their the culture of their classroom. And so children are just really, really open at this stage in their life. And so we are giving them as much as we can so that they're going to be able to progress and be ready for kindergarten or their next educational step once they leave us. So definitely the benefits are the overall development and children opening up and flourishing and ready to read, to learn, and just absorb all of the environment around them.
Now, I do have a question because I see this often with some of our children, and there's young ones who have autism, right? Do you guys welcome those children into Head Start, Early Head Start?
Yes, our program does support children or families that have children with special needs. And so during our enrollment process, there is an application process where we sit down and we talk to the parent about what are your concerns, what are your needs? And if the child already has some type of diagnosis, we partner with the doctors and the therapists to make sure that we're supporting that child's therapy or intervention, and making sure that we are actually implementing that on a daily basis within the classroom. So the child can be supported as they're moving through and making sure that they are thriving and growing at their level. All children grow and thrive differently, and we want to make sure that we're meeting the child's needs based on whatever has been discovered that they need. So absolutely, children that have special needs are absolutely welcome.
Dr. Reynolds,
And
can you tell us, as soon as they get into this program, once they enroll their child into this program, what can families expect play by play?
play by play, they can expect to be welcomed with open arms. We have a committed team that believe in what they're doing. But more than that, we're ready and poised to wrap our arms around the whole child and the whole family. As Tia mentioned, many of the benefits of the program, another benefit that parents can expect is that they will meet with our family service specialists and outline goals, not only for what they would like to see their child or children achieve, but for the family, for themselves. And so it's about making sure we move the entire family along. And so we have parents who come in, and we've experienced this over the years. We have a mandatory policy council where parents are elected at their centers and they come to meetings and they make decisions. This is one of the beauties of Head Start. The parents are involved in the process and they are required to vote and approve on our budget, any program options that we have. These selected parents come monthly, sometimes twice a month. So we've seen parents just as shy as their 4-year-old, they start making decisions and we see that confidence boosting. Our colleagues who welcome them from day one are still there cheering them on. And we've seen parents just, evolve and become the president of the policy council. We had parents leave the policy council, run for election, serve on our board of directors. And then by the time their child is in elementary school, these are PTO ready leaders. So the whole child, whole family, this whole process of truly developing starts with a Head Start. That wasn't play by play, but that was pretty.
That was. So what does whole child, whole family mean?
Tia will take that over, but I'll say this. In your traditional educational setting, we discovered that it is about education. We know that's so important. But what we have sometimes failed to realize is that children represent a large percent of our individuals who are in poverty. And if we're going to break that cycle of poverty, then we have to be cognizant of what they really are coming to the schoolhouse with or coming to the table. And so we recognize, not just us, but Linda Baines Johnson, 50 something years ago with the war on poverty, that we needed to address the social, emotional, cognitive, nutritional, all of these elements need to be met if we're going to break that cycle. So we have family style meals at our centers. And again, nurturing our parents, they are the first teacher, they are the partners, building their confidence, but while building it, providing the skills that they need to make sure that when they leave GCCSA at home, they can pass on that baton. So for us, it's about that wholeness, not leaving any area void of support. If you need dental care, we will help you seek it. And if you can't, we will be a provider. We will connect you to providers. We'll have the dental van come to the center. So there in our position, we don't want any excuses. When we say a Head Start means that we will eliminate barriers so that you can be a winner, you can succeed, then that's what GCCSA's team means. And Tia can take it over from here.
And Keisha, just to piggyback on what Dr. Reynolds just shared, the whole child and whole family, we know children, of course, we're in an educational setting, we want them to learn, but we also make sure that we're looking at their physical well-being, their health, their nutrition. Are there things or circumstances in the home that we need to work with the parent on and intervene? And then the second part of that is the whole family. We know family makeup and dynamics look very different across programs, not just programs, but across families. And so we really sit down and want to learn the family dynamic and find out, what are your goals? What if we have a parent that actually wants to go back and get their GED or get a degree or get a better paying job or buy a home, or that they need just some assistance, whether it's they need food in their home? We are there to really support whatever their needs are. So yes, the draw is the child, but we are definitely going to be able to support the entire family and find out what they need as long as they work and partner with us.
I absolutely love that. What do you used to often see once you have a family come in and like, you know, their child is there, but you can sense that they're behind. What do you feel like is happening with our children that they're so behind these days? Because I know for even like I look at my little cousins and they're on their iPads all day long. I feel like they're not learning the same way that we learn, even simple things like people skills, you know?
Right. Yeah. I mean, a lot of it, I'm sorry, Dr. Reynolds.
No, go on to you.
A lot of it is, you know, we are in a different digital age. And so we are working as a program to embrace that and bring that into the educational setting. But one thing that we're, you know, getting back to the basics of making sure that children have experiences. So opening them up to books and to learning and to reading, really bringing individuals, you know, COVID. And so last year we had some changes, but bringing experiences into our centers where children are able to experience animals or experience puppeteers or experience storytellers in their classroom setting. Yeah. So a lot of it has to do with their opportunity to experience things. We have some children who never left their neighborhood. Yeah. So we have to bring the world to their classroom. It is our job to identify what their needs are and what they may not have the opportunity to tap into and to bring it to them, as well as to find out what the parent, you know, from a parent's perspective, what do you want your child to experience? And sometimes, Keisha, parents just don't know. They're like, I know what I would like, but what is reasonable? What is realistic? And so really working and partnering the parents to say, all of your goals for yourself, all of your goals for your child, we're here to help you with that. And also just to let you know that all children grow at a different rate. Don't measure your child against someone else, but we are definitely here to bring the experiences to the child and to the family to make sure that they are getting that head start or getting to the same level some of the children throughout the city and throughout the nation have exposure to that. Some of our children just don't.
Did you want to add to that, Dr. Reynolds?
Well, and I wanted to add that Head Start, it's rooted in empirical data. And so we know that as trends evolve, we will get the message that it's time. A few years ago, we focused on marriages and couples and relationships. After that, we were focusing on fathers, and we had events targeted to fathers and bringing fathers together. And nothing is so much more refreshing than seeing a room back then when we could all come together, you know, hundreds of fathers and their little ones building vehicles and cars and transportation with cardboards and all kinds of, you know, art and paint. And I mean, it's so refreshing. And so these are opportunities for us to put aside the electronic games and having real human interaction, bonding, connecting. And our children don't realize they're having so much fun that we're making connections that are going to make sure that they're socially capable of achieving the success that they're purpose with. One of the things that I would go out as we go out and advocate for more money and trying to dispel this paradigm of those who need Head Start, I say to them that pull up yourself by the bootstraps mentality. We have to be sober about the fact that some kids don't have boots. Some kids don't have feet. So they have to be born in this situation, but we're obligated, I feel, and Lyndon Baines Johnson's administration and all the administrations since who have funded Head Start believe that our children will be successful if we can help meet these other needs that the family perhaps have been challenged. And we have the working poor. We're not talking about people who are lazy, whatever these negative mindsets are. That's not true. I mean, Harvey can wipe you out in a heartbeat. Pandemic can wipe you out in a heartbeat. Before you know it, you don't have income coming in. And an agency like GCCSA is here with an amazing Head Start program, high quality, free early childhood education. I mean, I would be running down folk to get my hands on some free early childhood education. And I speak personally as a mother who has twins who just turned 10, but that's another segment.
I saw someone comment though. She said all of my children went to Head Start, and I want to know about any of the adults. What does research show you that the adults now that once was in this program, and how well off are they right now?
So there's a lot of research that measures children when they were in Head Start and then follows them all the way through their educational career from elementary through high school. And one of the perks of Head Start, or the outcomes of Head Start, is that children likely to graduate high school, go on to college and receive postdoctoral studies. And then, just always have the opportunity to open up and tap into whatever their lane is. That's one of the things that we really try to instill in Head Start, is focusing on the individual child and their needs to help develop what is already placed in them as a gift. Some of the, famous Head Start children have been Chris Rock attended Head Start in New York, and Shaquille O'Neal was actually a Head Start child as well in New Jersey. So we got a lot of famous people, but there's also a lot of lawmakers, a lot of civil servants, a lot of teachers, nurses, doctors, judges, or individuals, may not have a title or a name, but they are doing really well for themselves. So Head Start helped to frame that for children and those who went that have been in Head Start and moved on, that I can truly achieve whatever I want if I just apply myself. We really try to work with children to instill that, this is, the classroom is a social experience. You are going to learn how to work with each other, how to share, how to communicate, how to resolve issues. And so framing that for a child so young, it helps them in adulthood to be more integrated into our society, and really instill in them that they have the opportunity. The only person that can stop them is themselves. And so that's one of the things that has always been able to instill in families. And we see it year after year after year when we have children and families come back. Some that have graduated from high school and college, staff that we have working here who either went through Head Start themselves, and now they're working here as professionals with us, and or just individuals who have come in and volunteered and said, you know what, I'm giving back to Head Start because I was a Head Start child. So definitely it's framing the future for our little ones, that they have the opportunity to do whatever they like to do.
Now I want to ask you both personally, what do you both love about the program individually? Like, not what you have to say, what you tell us about the program, but what do you like mostly about this program yourself that you see every day?
So I would say, for me, it is the interaction with the parents. Coming from an early childhood background where I was a teacher in pre-K and kindergarten, our focus was really always on the child and what was just happening there in the classroom. And I think Head Start, the beauty of Head Start is really pulling in the parent to say, okay, we have your child enrolled. We got this part of it, but now we're focused on you. What can we help you do to grow? This is just not for your child to learn and grow, but what can we do to help you get to another level? So for me, it's definitely the family engagement piece, where we bring families in and they're a part of a community at our centers, coming to parent meetings, getting involved. Dr. Reynolds shared about the Policy Council and our governance, and making decisions about the program. So I would definitely say the parents being involved, because the parents are the child's first teacher. Children learn what they see and what they experience. And so working in partnership with the parents, because that's one of the pillars of Head Start, has definitely been something tremendous, has a tremendous effect on me as an individual, and as a parent, really knowing now that I have to really work to engage with my child and be a part of that educational community for there to be a great outcome, not just for her, but for myself.
For me, I remember, gosh, it's been 15 years ago, early in my career here at Gulf Coast, a little girl, her father was on the Policy Council, and his daughter was very, very shy, introverted. The beauty of Policy Council, when they come to make decisions on behalf of the entire program, we provide the child care. We feed their kids. So again, it's that wraparound support so that you can be your best you. And she was very shy, but after every meeting, you could see this level of confidence boost because she's engaging with board members, other staff, and we had a gala that year, and she was identified as the one who would be on the program. And talk about command the audience of 500 people. So to see with my very own eyes the advantage of this type of exposure, I sleep at night and I still have the can't help it because I know what we can do. I know what advantages all children would have if they were given the head start. My kids were playing outside the other day, believe it or not, now that we're, getting back, and they're 10 and their friends 11, 10, but there was a little girl, she was 4, and she wanted to hang with the big guns, and they were racing, and they were like, okay, well, but we got to give Sydney a head start. And I was like, oh, they know about this head start thing. We did that back in my day, but I didn't know this generation. And so I'm curious, everything's a teachable moment. Why are you giving Sydney a head start? Well, Mom, she can't possibly beat any of us. She's too little. She's, sadly, one of them did say a girl, but I dealt with that later. So we have these constructs in our mind. Some we could dispute, but some are just undeniable. There's no way this person will meet the finish line, succeed, if we don't provide some opportunity, a head start, so that we can level that playing field. And so that's what we do here. It's not a hand out, it's a hand up, so that we can right some wrongs, but that we can all pass this finish line. Whatever that purpose is, GCCSA has the team that will make it all come true. And I will put 17 years on it. I think our website's on there. We want you to enroll, and there's our information. Call us.
What do parents need once they go to the website to enroll?
So when they go to the website, you'll come up to our homepage, and in the middle of that page is a lime green banner that says enroll your child now. And so when they click on that banner, it will take them to an inquiry, and you'll just give us some general information about you and about your child. And then one of our staff will reach out to you to start the application process. But I do want to make sure that I mention, Keisha, the ways that families can qualify for Head Start. As Dr. Reynolds shared earlier, we are a program that is at no cost to families. So we are a federally funded program. And so you do have to qualify for our program based on your income. And those income guidelines are based on what is established by the federal government. However, there are opportunities when we look at the family characteristics and dynamics that we may be able to serve children or families that are a little bit over those guidelines as established by the federal government. But you also need to make sure that your child qualifies by their age. So if they're older than 5, they will be going to like the school district or local school district here, which we partner with, but they would not qualify for Head Start because of their age. But and then we also look at zip code, and for Harris County or for Houston, Gulf Coast serves the southeast areas of Harris County and Pasadena. So we're mostly in the Sunnyside, 3rd Ward, Pasadena, East End, 4th Ward, downtown area. However, if families do reach out and they don't necessarily qualify for our program, we do have the opportunity to share with them about other programs that they may qualify for. But it's very user-friendly. And again, as Dr. Reynolds shared, you can always go to www.gccsa.org, and you'll be able to just click the link and go straight in, and we'll make sure that we get back with you once you make your inquiry.
And as you guys are both speaking, I'm like, it definitely takes a village. I just remember being I don't even know if it was Head Start, because I was so young, about 3 years old, I went to school. But it shaped who I am today. And everyone's always like, you have such great character and such. I said, listen, it's because what happened in my childhood, you know what I mean? So we have to start these kids off early. But I did want to ask you, Dr. Reynolds, are there any other service or opportunities that GCCSA provide?
Absolutely. We are a community action agency, and we believe in providing support and services so that we can make sure that individuals are self-sufficient. So if you're food insecure, meaning you don't have food in your pantry or in your refrigerator, we will provide food, no charge. If you have a desire to earn your GED, if you want to obtain a job that requires a certain skill, welding, truck driving, nursing, if you are a resident of Harris County, income eligible, meaning meet our poverty guidelines, then you will be able to access our funds free of charge. We have individuals who've gone through our welding program, and not ours, but we partner with programs and schools, and people end up with possibly can be six figures, but realistically, you're not in school for 4 or 5 years and find out that you're not able to get a job. We make sure that these are sound programs where it's focused, we pay for the scholarship, and if you meet your targeted goals, we will pay your rent, we will pay your utilities. This is part of the case management support. Why? Because we wrap around. If you have not had income coming in for a month or 2 months, it's not your rent. It's not only your rent that suffered, right? So gas cards, I mean, whatever it is that we discuss to help make sure you're successful, our agency has the funding. Eviction prevention, mortgage assistance, if you're in an emergency situation. So there are programs we have that are incentivized, that encourage you as you go towards your self-sufficiency goals. But if you find yourself between a rock and a hard place, GCCSA is here for you. We will work with your landlords. Some of them get a little testy, but we have an amazing team. They've talked down some tough folk because we all want their tenants to be paying tenants. And so our team is ready. We are available to make that happen. And that's just some of the services that we provide. We've been a beacon for many, many years, many, many storms, many, many situations, sequestration, furloughs, you name it. We've been here. And that's only because we have an amazing team. So, but we do want to be out of a job. We want to be able to assist everyone who needs us. So please, if you're able, reach out to us because we have the funding and we have the committed team.
Thank you so much, Dr. Reynolds. Now, is there anything else that you all would love to leave with our viewers here today that we did not touch on?
I would like to say, just as the I guess leader of the program, I really want to shout out to some of my colleagues. I see a lot of them in the chat, and it really literally is a family group effort to make sure that we are carrying out the support to our families. And so to every teacher, teacher aide, cook, custodian, center administrator, specialist, manager, AD, director here, it really is a group effort. And so I really want to just give kudos to the GCCSA team. We rock it out every day.
And I have to give a shout out to my board. They are non-paid board members, and we can't pass policies or make critical decisions without their strategic leadership and direction. So shout out to the board and to our policy council and all the stakeholders, legislators, those volunteers, those strategically aligned partners. 97.9 The Box, thank you for everything that you do, because you're helping us spread the word and make sure that we serve the communities who need us most. So thank you.
Well, thank you all for your hard work, Ms. Lee and Dr. Reynolds. One more time, what's the website, just for anyone that may just now be tuning in? And I know it's coming across here, but let's give it some one more time.
So it is www.gccsa.org. You can take your phone out and take a picture.
Screenshot. Take a screenshot.
Yes, we'd love to hear from you.
Thank you guys so much. We appreciate you. And thank you to everyone.
Thank you.